I want to know, how do you teach someone to tap into their own intuition and recognize it for what it is? Because your teachings are not just for practitioners. I believe it's for just Joe Smith out there who wants to become more intuitive with himself.
Oh, yes, for Jane and Joe, absolutely. And that's a big question. I've developed my and I'll tell you how I do this. I develop my programs, the main program, which is the level 1 and level 2 medical intuitive training, specifically for wellness practitioners, because my perspective on medical intuition is that this needs to integrate with healthcare. And the more people in healthcare, which includes health coaches and licensed massage therapists and certified, nutrition counselors. That's healthcare, right? All the way up to, MDs and all the rest of that, that level of medical professional. Everybody, um, well, I don't like using the word should, but in my opinion, everybody should have this skill or at least have access to it, because it is foundational. As I mentioned, it's foundational. So what your son is doing is this a good match? That's also what a medical intuitive can do. Take a look and see, if I look in your body part or that system that is asking for this, what is it asking for is really the question. And will this supplement work, or will this whatever? So medical intuitives don't diagnose unless they're licensed to do so. I'm not a medical professional in that regard. I'm a wellness coach. So I do not diagnose, I don't prescribe, but there are people who I've trained who can and do, because that's part of their scope of practice and their licensure. So I'm kind of talking around it. But when it comes to learning how to tap into your intuition, the thing that is most misunderstood in our society is that we can actually do that. People think you're either born with it or you're not born with it. People say I don't have an intuitive bone in my body, but the truth is that everyone has the skill of intuition. It's part of our human, toolbox. It's what we come in with. The question is for everyone is whether or not you want to develop it for yourself and why. So for everyone out there, the program that I offer is called the Medical Intuition for Healing Workshop. And that is for everyone to learn how to create, we call this the mind-body connection. You mentioned it in your introduction, is, how do we get these things in congruence, right? How do we get the mind and the body to connect? Well, I teach that skill for people to learn how to do that, to get the basic tools and practice them, and then have them for life, so that when they're having a health issue or they want more information, they can tune in and tap in and get that information. For the healthcare practitioners that I work with, it is a 1-year program, and it is a certification at the end of it as well. Very rigorous program, and they will be able to use it not only for themselves, but for their patients and clients. And that's when it gets really, really exciting, because there's no limit to what we can look at. It goes from not only anatomy, physiology, everything you were mentioning earlier, but also our life history. How did something manifest? That's the question we want to find out, right? How did this get here? How can it shift? What does my body want me to know?
Yeah. Before we go on, and we've got some people saying this is still, I know I'm questioning it. I want you to talk about some of the studies that you've done down in San Diego with the percentage accuracy, because that just is very black and white.
Yeah. So when I looked into the research on what was out there in medical intuition, there actually are studies, believe it or not, that reach back, 30, 40 years even, on this skill to see what can be proven. Most of the studies, I'm sorry to say, are inconclusive for a number of reasons. Partly because trained, qualified medical intuitives, there are some, but no one's ever really tested this before. And what I saw in my program is that my graduates were getting phenomenal results just in the case reports that they have to do. I mean, it's a rigorous program. We check everything. And because we were, hitting such anecdotal high accuracy rates consistently, I connected with some colleagues down in San Diego and said, hey, you know what? We really need to do a study on this just to see where we're at. And we put together an exploratory or pilot study on the accuracy level of these trained intuitives, these people from my program that had graduated. We had 5 of my students, graduates, and we had 67 people from the community, which is a good number. And some of them were from UCSD Health, the medical center there. And we did a session with them. Now, we did it as blinded as we could, which was pretty blinded. In other words, we don't do an intake. We don't do any of that. They were cold readings, you would call them. And we didn't actually have access to the medical records. So it was going to be a survey based on the participants' observations and what they felt was accurate. So what we came out with was, also, by the way, the medical intuitives do this with their eyes closed. So we weren't getting visual cues either. So that's as blinded as we had. We had the medical intuitives rated as 94% accurate in the assessment and evaluation of the participants' primary health concern, just right off the bat, which we thought was phenomenal. We also had a 98% accuracy in description of life experience that may have led to this health imbalance or this health issue, which again is a stunning number. And we also had, we had a lot of data, which is in now on National Institutes of Health PubMed Resource Center because it was published. We also had a 94% consistency with a participant's known diagnosis, right? So if they had a diagnosis from their doctor, they rated the medical intuitive as 94% consistent with that. Now, these numbers haven't been seen before, as far as I'm aware, in terms of what's been published prior. And that study was published in the Journal of Alternative and Complementary Medicine in 2020, which we're very proud of. It is the first published research in over 20 years on the subject. And as far as I know, again, it's the highest numbers of accuracy we've seen. So there you go.
Amazing. I don't know any other modality that has rates like that. It's pretty phenomenal. Why don't you give us a couple examples of case studies that you've seen?
I'd be happy to. The one I like to talk about is a really great example of how this skill works. I mentioned that we look at the physiology and anatomy, but we also look at the life history. So this kind of puts it all together so the audience can get a sense, your listeners can get a sense of what this is about. This was a woman who had a really persistent case of tendonitis in her wrist. And tendonitis is just annoying, and it can last a long time, especially in the wrist where you use it a lot. And she'd been to her doctors, nothing had worked. It was like a month long, and she was kind of tired of it. So she called me and we had a session. Now, when I look at someone's anatomy, what I'm looking at is just whatever the body wants to show me. And what it showed me was the inflamed tendons. You could see very red and inflamed. And underneath the tendons, there was what looked like a bone fracture that looked quite old. It had healed, but I could see the scar on the bone. And all around her wrist was this cloud of emotion and grief and heartbreak and, kind of strong emotion. And I asked, and this is a conversation between me and her wrist, right? And I said, okay, wrist, what do you want to show me? And it showed me images of her life. As I mentioned, you can see life. And for me, it looks like a little movie, watching a little movie. And I saw her at about 20 years old, about 20 years prior. She was in her 40s. She was playing tennis with her boyfriend, and she swung her racket and she tripped and fell and broke her wrist. And that was that healed fracture that I saw right there. Now, the next thing it showed me was her in the hospital room with her boyfriend and him breaking up with her right there in the ER. Right now, what her wrist was showing me was that there was this physical trauma of the fracture, but there was an additional trauma of the emotional heartbreak. Right. And that was all stored in that wrist. And it was one of the causes. It was really the energetic cause of the tendonitis. And at that moment, clients don't always remember things. Sometimes I see things that someone may not remember, but she remembered it. Excuse me. And she said, that she had just, her partner of 10 years had just broken up with her. So she was also going through a heartbreak then. And she had that aha moment. Her partner broke up with her right before her wrist flared up about a month prior. And that incident in her current life had activated this unresolved grief and trauma from 20 years prior. Now, that's a really typical kind of a session, but there was more here that I'll explain, and that was that her wrist had more to show me, and it showed me an incident from when she was about 5 years old. She was in a darkened closet. I could see the clothes around her. She was holding that same arm, that wrist up for protection, and there was a cane striking her right there. And it looked like it was a woman wielding it. And she just piped in and she said, "Oh my gosh, that's my mother. She was mentally ill. She used to beat me with her cane and lock me in a closet." And what her wrist was really showing was this entire lifetime, really, of pain and grief and physical trauma as well, right there in that spot in her wrist. Now, again, this is not unusual for the way I work and the way I teach. I want to see the whole picture here. And then the question is to the wrist, what do you need to heal? It showed me a few things. You know, her sleep was disrupted, her gut health was disrupted. It was all very emotionally based. And because of that, there was some information for her. And at the end of the session, she said, "Thank you." And 2 days later, she called back and she told me that the pain was gone. It had just disappeared. And what was most important for her and what she told me was that she felt more able to process the emotions of her current breakup. She was really holding them down during that whole time. And there you go. Now, not every medical intuitive session has a healing attached to it, but what it has is the opportunity to heal attached to it, which is really fascinating.